He is going to go into internal rotation of the femur by bringing his ankle outside of his knee, and he is going to push his ankle away out to the side. He's going to then go into retroversion of the pelvis, and he's going to go into hip extension by driving his hips as far forward as he can without losing the... Hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today we are going to be demonstrating the top 5 myofascial stretching exercises for low back pain. In terms of the exercises, we're going to be covering 5 different exercises. It's going to be the myofascial stretch for the Psoas major, the Rectus Femoris, the Adductor Magnus, the Piriformis, and the Longissimus. And in terms of all of these exercises, I don't want to waste your time, so let's go ahead and get started with the demonstration. The first myofascial stretching exercise for low back pain is going to be the Psoas major, and for the myofascial stretching exercise of the Psoas major, we are going to get in a half kneeling position. A half kneeling position, you are essentially in the bottom position of a lunge. So right now, the knee that is on the floor, that is going to be the Psoas major that we are going to be stretching. Since Michael's right knee is on the floor, we are going to be stretching the right Psoas major. Once we are in this position, I'm going to have Michael bring his foot out to the side, and then he is going to glide his hip over and translate his hip so that his hip is in line with his knee. From here, he is going to go into internal rotation of the femur by bringing his ankle outside of his knee, and he is going to push his ankle away out to the side. He's going to then go into retroversion of the pelvis, and he's going to go into hip extension by driving his hips as far forward as he can without losing the retroversion of the pelvis. He's then going to take his arms, go into extension of the elbows and wrists, and maximum external rotation of the shoulders. From this position right over here, Michael is going to side bend contralaterally, so away from the side that he's stretching, and then he's going to rotate ipsilaterally, meaning toward the side that he is stretching. You want to make sure that all of the range of motion is coming from the lumbar spine. So when you rotate, you shouldn't be rotating from the thoracic spine, it should just be from the lumbar. From over here, Michael is going to keep his chin tucked in, push the crown of the head up toward the ceiling, and look down at the floor with his eyes to put the dura mater under tension. And we want to keep all of these points of contact for the duration of the entire stretch, which is going to be 3 sets of 30 seconds. So I'm just going to cue him a little bit. Ankle is out, hip is forward, push into it, retroversion of the pelvis. Push out with the hands, push up with the crown of the head, keep that rotation, keep the lateral bend. And this is the myofascial stretching exercise for the Psoas major. Next, we're going to be doing the myofascial stretching exercise for the Rectus Femoris. The Rectus Femoris being one of your quadricep muscles. This one right over here, you are basically in the exact same position, half kneeling, so one foot on the floor, one knee on the floor. I'm going to have Michael bend forward at the hips, and then he's going to reach for his ankle of the opposite side. So right now he's going to reach for his left ankle, or his right ankle with his left hand. Because we are focusing on the rectus femoris, the most important thing for this stretch is trying to bring the heel as close to the glute as possible. You want to bring the heel toward the glute, and you also want to pull it across to the opposite glute. From this position, once Michael feels comfortable, he's going to take his forearm and rest it on his knee. Once he gets nice and situated and he feels nice and strong and stable in that position, he's then going to remove his hand away from the knee and go into flexion of the shoulder and maximum extension of elbow and wrist and maximum external rotation of the shoulder. Same thing at the head. He's keeping the chin tucked in, the crown of the head is pushing up, the eyes are looking down at the floor to put the dura mater under tension, and he wants to maintain all of those points of contact for the entire 30 seconds. Once 30 seconds is passed, he can then slowly come out of it, and the reason you want to slowly come out of the stretch at the end is to not recoil, because if you come out too quickly, you can develop a cramp. But that is the myofascial stretch for the rectus femoris. Next, Michael's going to take us through some more myofascial stretching exercises.
Okay, we're going to take Steven through the myofascial stretching exercises for the adductor magnus. Steven is going to start off in a hands and knees position. He's going to start to open his legs up wide. The knees are wide apart. The heels will be much wider than the knees. The goal is to start pushing the heels down towards the floor. He's going to keep a little bit of a retroversion of the pelvis here. The spine is tall. He's in the superior fibers are being myofascially stretched in this position here. Now, Steven is going to drop down to the elbows, and we're going to hit the middle fibers. He's going to pull the heels a little closer in so they're in line with the knee, and he's going to maintain that with the retroversion of the pelvis and spine tall again. And then from here, he's going to work on the inferior fibers where he will start to pull his heels closer together, as close as he can get together. And again, pushing the heels into the floor. He's maintaining that. Once he's in a good position, he can start to work his way backwards by just backing his bum up towards the heels and that is the inferior fibers of the adductor magnus. You have all three lines for the adductor magnus myofascial stretching. Okay, we're going to take Stephen through the myofascial stretching exercise for the piriformis. Stephen is going to have his right leg straight out. He's going to dorsiflex the foot and internally rotate it into a pseudo-eversion with the foot here. He's going to be leaning back with a tall spine. That's his start position. He's going to bend his left leg and have the foot out to the side, and then he's going to slowly start to work his knee down towards the center part of the floor with this leg here. And you want to try and work on pushing the ischial tuberosity into the floor of the knee that you're stretching, the leg that you're stretching. He's going to maintain that. If he can maintain that, he can start to work his body closer up into a higher position. If you're having trouble with that, stay in that far back position and have the leg lifted here and work on that range right there. We're going to do myofascial stretching of the longissimus muscle. Stephen is going to start in a seated position. He's going to bring his legs out to the side a little bit. He's going to bend his legs a little bit. He's have the heels contact into the floor. He's going to now take his hands forward, myofascial tension by rotating and pulling the fingers down. He's going to start to push his sternum back and lean forward and reach and chin tuck towards the clavicle line. And he's pushing and rounding the spine here in the thoracic region and really pushing forward and reaching back with the sternum and pulling the heels into the floor for more tension and holding that for 30 seconds and repeating up to 3 times. That's myofascial stretching of the longissimus.
And there you have it. Those were the top 5 myofascial stretching exercises for low back pain. If you have any issues with low back pain, give them all a shot. Whichever one you feel you are most restricted in, that's probably the one that you need the most, so you can perform that one regularly. But if you do have issues with low back pain, check out our seminar on September 18th, because we're going to be going over all of these exercises and a whole lot more. That seminar, it's going to be for low back pain, shoulder pain, and neck pain. So if you have any issues in those areas, or if you are a clinician who treats patients with issues in those areas, you're definitely going to want to sign up for that. But that's pretty much it for today's video. If you enjoyed the video, be sure to smash that like button so we know to make more of these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel or hit the notification bell, as we will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.